Welcome back. Among more than 250 Maryland bills that came into effect on July 1st is legislation that will ensure funding for Planned Parenthood's healthcare services in Maryland if the United States Congress should block it from receiving federal funding. Brian, do you think Planned Parenthood should have a place in our state budget?
I think it should if the U.S. Congress decides not to fund it. I think there's a lot of misconception about what Planned Parenthood does. And just in Maryland alone, 25,000 patients a year go to Planned Parenthood clinics. Now, they're not all going to have an abortion. There are other services that these places do offer: breast screenings, breast cancer screenings, mammograms, things of that nature. So, I mean, it's a medical need. I think it's there for the public to be somewhat interested in terms of tax dollars. But federal law also prohibits money going to abortion. So there's that confliction there.
So how do we segregate that? Because you're right, they do offer services, essential services for health care. But you're also right that federal law prohibits funds from going to abortion. So
Right.
we assume that they have this wall
Right, the wall of that, yes.
that prohibits that from happening.
Mm-hmm.
You know, there was these videos, and people say, well, you know, it was staged, it was this, it was that. It was also pretty compelling in my view. I mean, I don't know whether it was doctored or not.
Mm-hmm.
It didn't appear to be to me, but that's a big issue in my book.
It's a very sensitive issue all the way around.
And the governance thing, where do we draw the line on funding?
Well, you know, one of the beefs I have with Planned Parenthood, besides the fact that they perform abortions, one of the beefs that I have is that they use funding and they are constantly being plastered over television saying, hey, don't let Congress cut my fund, don't let Congress do this. You know, if they have that much revenue that they can afford to take ads on major networks, maybe they have too much revenue. And you know, you mentioned they do mammograms, yet mammograms aren't really something that they do. They're focused on, you know, essentially reproductive services, and they do some good. Okay, I'm not going to throw them entirely under the bus. I personally and religiously have not, you know, a problem with them conducting abortions. My issue is that federal money that they're asking, or if the state takes away, and you know, the governor didn't sign the bill. The governor could have vetoed it. Okay, the governor didn't sign the bill. He just allowed it to become law without putting his name on the paper. I have some real issues with, you know, even the state stepping up and doing it. You know, if they're focused on reproductive services, and fine, focus on it, but don't be plastering my TV with ads asking for more money. Yeah. I don't think that's appropriate.
And here's the thing with the people who scream that if we defund Planned Parenthood, all of a sudden there are going to be women who can't get preventative care, and you know, it'll be all of a sudden Armageddon. The fact is, there are, according to a study from the Charlotte Lozier Institute, there are 13 times more federally qualified health centers than there are Planned Parenthoods in the United States. Now, these health centers are places that provide the preventative care that Planned Parenthood does, and they accept stuff like Medicaid, like Medicare. They'll accept federal assistance like that. And do you know how many of those centers are in Maryland? 155. There are 7 Planned Parenthood clinics now in Maryland. So the idea that suddenly Maryland women will be, you know, facing the end of their ability to access these services besides abortion that Planned Parenthood provides.
But that is a specific issue, the abortion aspect. Planned Parenthood does provide abortion services.
Yeah, and I think it was put pretty well, where if you're giving money to Planned Parenthood for things that aren't abortion, they're of course going to have more money for abortion. You know, right now you can't afford a vacation to Hawaii. If suddenly someone gives you $10,000 and says use it on your mortgage, what are you going to do? Take the mortgage money and you're going to spend it on your vacation to Hawaii. So I think funding Planned Parenthood on a federal level is problematic. I think funding it on a state level is problematic. And I think if we take away that funding, it won't significantly hurt women in the state of Maryland and nationally. And in states where this has happened, like Texas, there was not a rise in abortions. There was not a rise in unintended pregnancies when Planned Parenthood was defunded.
But you know, if you call almost any doctor anymore, and it's not something where you can get in the same day that you call, or perhaps even the same week, or in many cases, I just scheduled a dentist appointment for my daughter, and it was a month and a half till I could get in. So I'm not sure, even with a reduction of, you said 7? You said there were 7 planned?
There are 7 Planned Parenthood.
But there's
in the state of
150
Maryland.
other that
I
provide
get
similar.
that. I get that. But I'm assuming there are 157 in total, including Planned Parenthood, because they all have business. So I guess my point is that for me, it's a difficult thing. I am an odd person because I'm a Republican who's pro-choice. I could tell you what my choice, which is life, but I don't feel that I have the ability to enforce that on others. I do have a problem with federal funding of abortion. I do have a problem with what I saw in those videos. I do have a problem with some of the things that I believe Planned Parenthood has at least been accused of, and I think they would be hard pressed to deny. But I don't know how you separate the two.
Well, my challenge is, how do you say that the money doesn't go to help subsidize abortions if it's coming from the federal government? And Maryland does not have a law that would prohibit that funding helping with abortions. So that I know it says it will replace the money that's no longer available by Congress, but Maryland doesn't have a law. But Planned Parenthood is essentially a private business. So it would be no different than Jim's business, that he goes there and says, will you give me some money because I want to do this? I don't think it's being equitable to other businesses that are in the community providing reproductive services and advice to give Planned Parenthood a nod up over top of those.
On the political issue, though, the governor didn't see fit to veto the bill.
And
He knew it was going to be a very political hot potato for him.
And I'm not one of the governor's advisors, and if I was, I probably would have advised him to probably take the neutral stance.
I think the governor, not to switch conversation for the last minute of our conversation, but I think the governor has been fairly savvy when it comes to some of these political maneuvers that he's accomplished here over the last year or so. I think that no signing the bill really suggests that in his mind he sees what I suggested, that there's two sides to this argument, and I don't think we have enough information at this point to decide, because I think we're all being fed by the radical right and the radical left, and the reality is probably somewhere in between. Just my opinion.
Yeah, we could talk about this all day, but up next, our panel takes a look at this week's winners and losers. We're back in 3 minutes.